Hello friends. So in this short video, we are going to talk about the role of amiodarone, the drug used as an anti-arrhythmic agent, and its impact on thyroid function. So this is often a question which is asked as a short note in undergraduate examinations for medical students and even for postgraduate students in medicine. So amiodarone and thyroid function. Amiodarone is structurally related to thyroid hormone and it's practically 39% iodine by weight. Now, this figure may be different at different sources, but roughly about 39% of amiodarone is iodine by weight. And this is typically given in a dose of 200 milligrams per day and thus delivers a very high iodine content with its every dose. So it inhibits the deiodinase activity, has a weak antagonistic action of thyroid hormones, and causes an acute transient suppression of thyroid function. It inhibits the conversion of T4 to T3, and the iodide-dependent suppression of thyroid is also called the Wolff-Chaikoff effect. So by this mechanism, it produces hypothyroidism, which is transient, but then the amiodarone is also so characteristic and so popular among teachers for questions is because it also causes hyperthyroidism by a different mechanism, by what we call the Yod-Besedorf effect, which is iodine-induced hyperthyroidism, which was first discovered in iodine-deficient patients. When they were given large doses of iodine, they developed hyperthyroidism. So hypothyroidism is more common in women with anti-TPO antibodies positivity. And in these patients, there is no need to discontinue amiodarone because the replacement with levothyroxine or LT4 is easy. Amiodarone can also induce thyrotoxicosis, which is more difficult and it might exacerbate coronary artery disease and arrhythmias. It is seen in 10% of those who are living in areas with low iodine intake. Now, amiodarone-induced thyrotoxicosis is of two types, AIT1 and AIT2. So AIT1 is when there is an underlying thyroid disease. So when amiodarone causes or induces thyrotoxicosis in the presence of an underlying thyroid disease, it's AIT1. And when amiodarone causes thyrotoxicosis in the background of a normal thyroid, then it is called AIT2. So when it is AIT1, we treat with perchlorate, while AIT2 is treated with steroids. Now, this should be sufficient for a short note or a limited answer on amiodarone and thyroid function. Wish you the very best of luck and thank you for stopping by.